Hello, Dayna Johnson here. We are filming from beautiful Deception Pass, Washington, one of my favorite places in the world to shoot from. It's actually my hometown, and so I'm very happy to bring you this beautiful scenery to our first What Would Dayna Do? So while I was in ADOM conference a couple weeks ago, I had an ADOM member put me on the spot. And here's what her question was. I didn't get her name, but she's been in dentistry for about 20 years, and now she's just started with a new practice. She's been at this practice for about a year, and her question to me was, how do you get a team member to stop gossiping about other team members? Wow, this is a big one. So what I suggest is every office should have an office manual, whether it's on HR, OSHA, WISHA, HIPAA, everybody should have a manual. And in that office manual, you should have guidelines for your office on behavior. And this applies to all your team members. So you're not pointing out that one particular team member, maybe in a staff meeting or, one-on-one, but all that behavior applies to the entire office. So make sure that those policies and procedures get documented in your office manual. And I can almost guarantee that if it applies to everybody, that one team member will notice that it is about her, but it's applied to the whole office. And see how that changes things in your office. And moving on to our next question came from Dr. Chris from San Francisco, California. And he sent me a question. So I'm still trying to figure out how to implement a tablet computer into my practice. What would you suggest? So my suggestion when you're picking technology or when you're choosing the right tablet, make sure that it has a lot of flexibility as far as implementation into your practice management software. Are you going to be using it for patient forms? Are you going to be using it for digital x-ray, treatment planning? You want to make sure that that tablet can be used for multi-functionality in your office. And you also want to make sure that it's user-friendly, because more than likely it's your team members that are going to be using it and handing it to a patient for filling out forms. So make sure it's user-friendly, make sure it has a lot of flexibility so you can use it in multiple places in your practice. And the third thing is also you're going to have to password protect it if you're going to be handing it over to a patient. So make sure that you have those things in place and you're going to be good to go.